One of my passions is rhinoplasty, and because I do a lot of primary rhinoplasty, and I have been doing it for 25 years, I see a lot of patients that are unhappy with rhinoplasty done elsewhere. So revision rhinoplasty is a big part of what I do in my practice. When I see patients to contemplate revision rhinoplasty, we have to talk about a whole lot of things. We have to talk about some of the things that we talk about with primary rhinoplasty, but there are unique problems that are created from already having surgery before. Typically, if someone had their nose done elsewhere and they're unhappy with the result, they're somewhat traumatized. And so they are concerned that they will never get the nose that they want. They had surgery by somebody else, they trusted that surgeon, and unfortunately it didn't work out. If you look at everybody that gets their nose done around the world, 15 to 25% will get redone. The operation is intrinsically hard. That's why it's important that you go to somebody that has a lot of experience for primary rhinoplasty, but you have to understand that even in the best hands, there is going to be somebody who's not completely satisfied with the result. So, when I see patients that are unhappy with their primary result, what I want to do is I start all over again with fresh eyes. And the first question is, what don't you like about your nose now? Not when you went to see the surgeon before, but what don't you like about your nose now? So in some ways, I get to start fresh. I didn't create the problem. I'm not emotionally attached to what happened before. I just want to make it right for the patient now. So we start again. What don't you like about your nose now? And they'll tell me specifically what they don't like. And then I will devise a plan to fix that. Now, doing revision rhinoplasty is different than primary rhinoplasty because somebody had their nose at a certain position, they had surgery, maybe multiple surgeries, maybe a trauma, and now they're at another position. So what I like to do is a little bit of forensic plastic surgery. I like to get all the information that I can before I go in. So if I can get the original pictures before the surgery, if I can get the operative notes from the other surgeon, and then just talk to the patient about what transpired through those years. So the goal is to find out where they started, what was done, what the result from that surgery, meaning their post-operative pictures, and where they are now. And often that will give me information as to how they healed, how they responded to the initial surgery, so I can make a new plan that will give them a better overall result. So revision rhinoplasty is very challenging, but it's something that I love to do, and I think that being a good revision rhinoplasty surgeon has made me a better primary rhinoplasty surgeon. It's allowed me to help more patients than ever.